Hello, good afternoon. I am Dr. Ponnu specialist neurologist at Aster Hospital, Mankul, Dubai. So in the previous videos, we spoke about the risk factors of stroke, the various symptoms of stroke. So today I'm going to talk about the treatment of stroke. So before understanding what is the treatment of stroke, we should know that there are two types of stroke mainly. The first one is called the ischemic stroke, whereby there is a blood clot in the blood vessels. Blood vessels are nothing but the tubes that carry blood to the brain. So when there is a block in the brain, you get something called an ischemic stroke. Ischemic stroke is the most common type of stroke. It accounts for about 85% of all strokes. The second type is called a hemorrhagic stroke, whereby there is bleeding into the brain. The blood vessels burst open and the blood flows out into the brain. It's called the hemorrhagic stroke. So the treatment for both are completely different. The treatment of ischemic stroke is blood thinner, whereas blood thinners are contraindicated or cannot be used in bleeding or hemorrhagic stroke. So let's discuss in detail about ischemic stroke, treatment of ischemic stroke and hemorrhagic stroke. Ischemic stroke means the stroke due to a block in the blood vessel. So here the mainstay of treatment is blood thinners. So we can divide the treatment of ischemic stroke into mainly two types. One is an acute treatment. Second is preventive treatment. Acute treatment means when somebody comes with new onset symptoms of stroke, what kind of medicines do you give? That is what is called acute treatment. Preventive treatment means the treatment that you give on a daily basis so that the person doesn't get a second stroke or a recurrent stroke. So ischemic stroke, as we have discussed in the previous videos, it means there is a block in the blood vessels. So blood thinners are used in ischemic stroke. So when a person with new onset symptoms of stroke, such as drooping of face, weakness of hand, weakness of legs, or slurring of speech or difficulty to speak, comes to the emergency or the hospital with these symptoms, then if the patient comes within 4.5 hours of onset of the stroke, or onset of these symptoms, then there's a specific medication or an injection that we can give to lyse the clot or burst the clot. It's called a thrombolysis treatment. So what is the utility or what is the benefit of using this treatment? So if this medicine can be given within 4.5 hours, the chance of recovery, the paralysis is much higher, or there's a faster recovery from the paralysis. So like I said, there is a time period, it's called a window period. So the patient has to be brought to the hospital within 4.5 hours. It doesn't mean that we'll have to wait till 4.5 hours. As soon as possible, the patient has to reach the hospital. The early, the better. So in all cases, thrombolysis treatment may not be possible. There is some criteria. So there's something called an NIHS score. So and so many other factors which we take into consideration, and if the patient is fit for thrombolysis, we administer the injection therapy. So if the patient comes after 4.5 hours, he is not a candidate for thrombolysis treatment. In that case, there's something called a mechanical thrombectomy treatment that we can offer the patient. So this mechanical thrombectomy is usually done for large blood vessel block or large blood vessel stroke. When a large blood vessel is blocked, this can be administered. It's not available in all centers. Only those centers with interventional neurologists will have this facility. So this is whereby the clot is mechanically taken away or taken out of the blood vessels. This also has been beneficial in improving the paralysis, or there's faster recovery from the paralysis. If the patient's present after the window period for mechanical thrombectomy or thrombolysis, that is injection or the mechanical thrombectomy, regular treatments such as antiplatelets or blood thinner tablets are given. So about mechanical thrombectomy, I said it can be done up to 6 hours ideally, but in selected cases up to 24 hours also this treatment can be done. But all patients with paralysis will require physiotherapy. Physiotherapy, the importance of physiotherapy, I cannot emphasize more. It's very important for all patients with paralysis. It's important that they take physiotherapy until the improvement of the power. If the patients have any speech difficulty, talking difficulty, then they can take speech therapy. So these are the rehabilitative measures. This is in general about the treatment of stroke. So the preventive treatment, blood thinners for ischemic stroke is lifelong. Then now we'll discuss about the treatment of hemorrhagic stroke or bleeding in the brain. So as I discussed already, the treatment of bleeding into the brain or hemorrhagic stroke is completely different. We cannot give blood thinners in this kind of stroke. So the treatment would be just controlling the BP. And in case if the bleeding is too huge and there is swelling of the brain, anti-edema measures or injections to reduce the swelling of the brain can be given. And again, if the injections are not able to control the pressure inside the brain or the swelling of the brain, then decompression surgery or surgery to reduce the pressure will have to be done. Thank you.